Okay. Hello.
Right.
Hello, I'm Lesley Allen, and I'm the Library Services Manager working at Birmingham Community Healthcare NHS Foundation Trust, based in Birmingham, clearly. And I'm just going to go through and talk a little bit about my involvement in knowledge management. Um, I have to say, it's been very slow progress to date. So I've tried over a number of years, since, well, yes, it's since the Knowledge for Healthcare framework came out, and we started talking about this kind of thing, and we had the toolkit to look at. I've been trying to engage with people within the organisation about the toolkit and also the different tools that are available that might help support some of the activity of the trust. And that's how I kind of got started. But I've had basically no interest shown. I've either been ignored or just had um, kind of nodding reference to it, but then nothing's come of it. And I guess it's a two-way thing. I should have possibly followed up more with it, but I think I was disillusioned by the sort of blank looks on everyone's faces. Um, so I think probably that didn't work, possibly because of a lack of confidence on my side in terms of being new to it all and not really understanding enough to talk about it in a more authoritative way. But also, in retrospect, I think there's something to be said for looking for the right opportunity to hang these things on, rather than just just sort of mentioning them in a meeting as a sort of byproduct of something someone said. I don't think there's any harm in that because it starts to get the idea on the agenda. However, I don't think it's necessarily the best way of doing it. So that's what I would say in terms of future work. So what's worked for me is more recently, I involved in a piece of work about remote consultations and had an idea around how we might work with local partnerships in public libraries, in terms of having a safe space, both COVID secure and confidentially safe space, for people without their own IT equipment or necessarily skills to use it, to have virtual consultations. So we're looking at video consultation rather than telephone consultation. And so I ended up, as a result of that, having a meeting with our medical director. And off the back of that, I started talking about digital and health literacy, and the link between the two. And then somehow I managed to shoehorn in the board toolkit, and start to talk about how that was important to find out what we were doing as a wider organisation, linked to work he was interested in from CQC visit about lessons learned. And even though I'd spoken to him about this toolkit before, he'd not been interested, but all of a sudden he had some kind of light bulb moment, and he was on board with it straight away and was asking me whether we had, whether we could do it electronically or whether it was just paper based and blah, 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 blah. So that worked really well because I think what it did was tie into one of his priorities at that moment. And that's why I think he showed the interest. So I've had a couple of more meetings with him since around the sort of lessons learned kind of work that fits in with all of this. And my favourite comment from him is that I'm really surprised you know so much about important things, um, which could be taken either way. But I laughed and said, "Oh, thank you." Um, but I think it was quite a nice comment that actually suddenly the penny had dropped, in terms of how much services can support the wider work of the trust, at a more strategic level, and that hadn't really been recognised before. Um, so I'm really enjoying getting involved in this kind of work because it's given me opportunity to work with people more closely that I've not had opportunity to before, and also to get the library service recognised in other places where it had not been much of a focus for people. So what I would say to anybody looking to get involved in this is don't give up, even if it's kind of disheartening to begin with, and really pay attention to what's going on in your organisation in terms of what the hot topics are, you know, what's come through from CQC reports, what's going on maybe in response to COVID, you know, anything that's going on that's the key thing for your organisation, because I think if you can show how you can support that and go in with a solution, that's when people are more likely to want to engage with you, because you've got an answer rather than a problem. So that's what I would say about my journey so far for knowledge mobilisation. So we're you know, having been involved for quite a long time, it's only really just starting to take off, but I'm positive that I'll be able to take this further now on the back of what I'm doing currently.
Excellent, thank you. Okay, definitely in a stronger position than me, I think. So I am Emma Aldrich. I'm Head of Library and Knowledge Services at Maidstone and Tunbridge Wells NHS Trust. Our organisation has made the right noises at varying points over the last several years, really, about knowledge management. We had some small successes when knowledge management really became a thing quite some years ago in running a few lunch and learn type programs, just to introduce basic knowledge management tools to the wider trust, and we did have a little bit of uptake in those, and we certainly had quite an enthusiastic Chief Knowledge Officer for a while when that post was rolled out in NHS organisations. I think there are pockets of good practice around knowledge management that happen across the organisation, but they're things that we are not necessarily involved with from the library perspective. So people are sort of broadly doing their own thing. And I think one of the pities with that is that they're not sharing some of those good tools and good bits of practice with each other and the wider organisation. And I suspect that is something that the libraries could get a little bit more involved in. I attended the 2-day knowledge mobilisation course earlier in the year, found that really very useful. And I think for me, some of the take homes from that were to not get hung up too much on the kind of the software or a platform or the mechanism for capturing that information, but just jumping in and offering it. And if what the output is a Word document or a basic Excel spreadsheet, but it actually does something to contribute to knowledge management within an organisation, then that's fine. It doesn't have to be this amazing SharePoint database that's all singing and all dancing. So I did find the course really very useful and left that feeling quite fired up. Went on annual leave for a week and then walked back into an organisation that was listening avidly to the news of the incoming pandemic. And then I was redeployed. So I had good exposure to the exec body and the incident command centre during my redeployment period, but I think the scope for doing anything outside the sort of immediate requirements of sorting out staffing for the organisation and PPE and those very sort of dire emergency type issues, it was a bit limited. But now that things are settling down, what I'm finding is that we have managed to gain some recognition for the roles that we played while we were redeployed, and people are beginning to understand what we can offer and approaching us to with some of those wider questions. I think they've understood finally that we are not just issuing books to students, and that our remit is a great deal broader than that. So in terms of sort of actual knowledge mobilisation activities and tools that I've been involved in or attempted to deploy over the course of this year, I'm going to be honest and say it's been pretty much nil. The only thing that I've been involved in was working with my team to collect some lessons learned information for someone in the project management office, to sort of pull together a wider piece about how staff were redeployed and how that worked. And I'm actually really disappointed that as an organisation, we seem to have been quite hung up on collecting that information from departments and from members of staff, but not actually doing anything with it. So I think there's a huge disconnect out there still between doing the right thing and then actually doing something with the information that you have collected. So on paper, the lessons learned activity looked great. It was a massive spreadsheet. We had plenty of opportunity to talk to staff about their experiences of redeployment during a pandemic, with all that nice soft stuff as well. You know, did we consult with you? How did you feel? How were you treated? As well as sort of assessing of skill sets. But as far as I am aware, nothing was actually done with that. It's all been collected somewhere and put in a spreadsheet on a drive somewhere, and it hasn't been used again since. So that, you know, I think that's the sort of thing that I can potentially take back to the incident command centre with a question saying, you know, we're into the second wave, we're looking at redeployment again. What happened to the lessons learned? How have those been shared with senior management in terms of how they work with their staff? And just ask some of those questions. And then, you know, for me to understand that if I go in and ask those sorts of questions, I am actually doing a little bit of a knowledge mobilisation piece. It doesn't have to be some huge, great, big, fancy project. It's just prompting senior people within the organisation to just think those activities through from start to finish and share what's happened with those. In terms of things that are coming up, I've literally just come off a call looking at the mass vaccination programmes that are being rolled out across the NHS, and the learning and libraries team will be pretty much running the show. They're going to take over the libraries, academic and education centres across our two-site acute trust, and we will be staffing those centres in terms of collecting consent forms, cleaning surfaces, directing people in the right places, ensuring the right flow of people through the buildings and so on. And so we're dealing with so many unknowns. We're planning for 7,000 vaccinations in a week. We don't know how many of the 7,000 employees in our trust are actually going to want vaccinating those. So we're planning for a scale of 48 vaccines being delivered per hour. There's a very good chance that maybe 3 people will turn up in an hour. We don't know. So I think there is some good opportunity as that week goes on. We've got a 7-day week where we're planning to roll this out, to be doing fairly continual during action reviews, just to tweak the process as we go, and think a bit reflectively about what's working as the hours wear on during the course of the week. So there, you know, I am, I suppose what I'm doing is thinking about those sorts of things a little bit more strategically and with a bit more of a KM tools hat on, as opposed to, you know, putting that KM spin on something that we might have done anyway. Yes, we might well have made some decisions about changing the process halfway through the week if we don't get the uptake, but actually in a period of time where everything has to be very carefully audited, and every decision needs to be recorded with the discussions that surrounded it. I think if I can go into that environment with that during action review tool and say, let's use this tool every day to review how the day has gone and map out what we might want to change for tomorrow, we've got a really nice bankable piece of evidence, should we be audited in 10 years' time, as to why we made a decision to reduce the capacity within the buildings or whatever. we have got that tool ticking over in the background, collecting information for us. But whether that will happen or not, I don't know. It's going to be an interesting week. It's nice to think about these things in theory, but whether we will have the opportunity to do it in the way that I am envisaging will be another matter, I think. So I think that's sort of where I'm at. I think in terms of the sort of the key recommendations that I would give to someone thinking knowledge mobilisation would be to just any opportunity that comes up, to be having those tools in the back of your head, and how could we use one of these to improve the process. So actually, you know, a mass vaccination programme a few years ago would feel like it's well outside of the remit of libraries and really nothing to do with us at all, and not normally something that I would have been involved in. But I think certainly my experience of the pandemic so far is that we are being exposed to a huge range of staff and a huge range of opportunities, and we just have to keep seizing those moments and having a go, basically, not being afraid to say, oh, I've got this tool, let's do it like this. And if it doesn't work, it doesn't work, but at least we're not missing those opportunities. So I think it's that kind of be a little bit opportunistic, rather than taking a tool and thinking, well, I really like the look of this one, how could I use it? Let me go and find some people who might be interested, is looking at what's going on within the organisation and thinking, what have I got in that suite of tools that might actually help these people to deliver what they need to deliver?
Yeah, I would agree with that. I think one of the things I've picked up recently from some of the November webinars I've been at is not being afraid to use different language to describe some of these tools.
Yeah.
So rather than using the sort of KM language, use language that's going to mean something to people. Because if you said, I don't know, after action review or during or before action review, people might just look at you blankly and think, I've got no idea. But if you said, oh, actually, how about if we looked at it like this, and kind of described it more rather than just saying the phrase, it might start to help things sort of move along. So that's something I've picked up quite recently, really, through the November webinars, which I'm going to use moving forward as a different approach. And I think it goes hand in hand with kind of developing more confidence in the tools as well. That you can talk about them without using their terminology, if you like, so that it might feel more adaptable and doable and not such a thing. Because I think sometimes if you say knowledge management to people, it feels quite big, which it is in many respects. But I think if you can kind of pare it back to the immediate thing that's in question, it's more manageable for both you trying to do it and other people trying to understand what you're trying to do in the first place. And the other thing that's occurred to me while you were talking is something that I always forget, and I think it's because we've been doing it for so long. In terms of knowledge mobilisation, we have a knowledge database here, which is a bit like a repository, a bit. So we collect people's research and that kind of thing, but we also collect quality improvement projects, that kind of stuff. So we've got a little in-house database that one of my library colleagues developed with lots of different headings, so we can put audits in there and that kind of thing. So that's another way of sort of mobilising our internal knowledge. And we're also involved in policy work as well, in maintaining the policy database. And again, we've been doing that for donkey's years, and I kind of forget about it because it's become so day to day.
Business as usual,
And when we started it, we weren't talking about knowledge management. So I think you kind of forget that that's actually what it is. So there's two other things that are going well, actually, that people probably a few people involved in similar kinds of things, I guess, with repositories and policy type work, or patient information, even if they're working in gathering that, and maybe have a database or whatever. But I think you're right about not worrying about the tools, particularly in terms of databases or that kind of thing. It's about looking at what's going to work. And I think it's about breaking it down into smaller parts before you try and put it back together. Because otherwise, I think if you start off too big, it's less likely to succeed.
And I think I don't know, maybe it's just by virtue of the fact that we like to think that we are good at organising things and creating data banks of information. I know I certainly end up getting hung up on the way something is going to look, the way a whole package of information look, where actually that's not necessarily what the output needs to be. That's not necessarily what the organisation needs. It might be that what we do need is a really lovely looking website with a database that sits beneath it that makes something very accessible, but actually it might equally be a few notes out of the back end of a small conversation that others, we might call it a fishbowl exercise, but others are thinking, it is actually just a conversation with a bit of direction that we've helped to facilitate, and a little bit of verbal feedback around that is all that's actually required. So I do get hung up on that. Ooh, well, I could put this logo here and I could make these cells this and actually that's that's not really what KM is about at all.
No, and I think those are the kinds of I don't know, bells and whistles things that you can put on afterwards on the top. But it's as you say, it's more about getting something that's workable and usable, and that people understand what it's there for. I think so. I don't think I've got anything else to share with people. Have you, Emma?
I don't think so. Just having a quick look through some of the questions and prompts. I don't feel like I'm very well established down the knowledge mobilisation, knowledge management route yet, but
no.
It's I certainly feel as though I'm in a stronger position than I was this time last year. But
definitely. But I'm nowhere near doing any evaluation of how it's impacted or anything like that yet. I think it's a slow start, but I'd rather that than try and do too much in one go, and then you're kind of falling over yourself trying to catch up. And I think probably you're less likely to succeed if you're trying to do too much at a time, sort of baby prove steps. Something exactly, baby steps. So well, thank you, Emma. I'm going to stop the recording now. So I hope everyone's found this useful. I've certainly found it useful hearing from Emma. So I hope everybody else does as well. Thank you.
Thanks.